Let's welcome board-certified plastic surgeon, Dr. Phillip Khan. Dr. Khan, it is so good to have you back on the show today. It's always a pleasure to have you here.
It's great to be here. It's always exciting to be here also.
It is.
I enjoy it.
Great. Well, I understand that Novant Health's coastal plastic surgery recently moved to Southport, correct?
Absolutely, we have, and it's a great location. I'm really excited about it to be able to broaden our scope to a different part of the county and allow us to keep really our grasp on what we've got now. It's a really exciting time for us.
Now, where is it in Southport?
So it's at 1456 House Street at the old multi-specialty clinics for Novant Health, where many people had their primary care doctors before.
Right.
And where people see the general surgeons as well as urology and the obstetricians.
Right, and it's right across from that restaurant.
Famous Subs.
Famous Subs.
Absolutely.
That's a great landmark.
It is, most definitely. It's a good place to go for lunch, too.
It's a great place to eat. I love to eat there. So, well, I do know that you offer a broad range of services, but today our focus is going to be on Breast Cancer Awareness Month, since it's October. And we've met Dr. Bodenheimer. He was here earlier and talked about detection and early diagnosis and what have you. And then we talked with Dr. Scallion, and your name came up because often you work together. So I understand that you have a great deal of experience in reconstruction. So talk to me a little bit about that.
Yeah, I've trained in so many different places that I have an experience in reconstruction at all gamuts of the spectrum. Whether it be reconstruction from a mastectomy defect where a woman has lost her breast, or whether it be something such as a lumpectomy where they just have a contour deformity after that. And the extensive training I had from Texas to Charlotte and all over the country allows me to see even those patients who had reconstruction in the past that need adjustments, that may need something else down the line, or even women that have never been reconstructed before that decide to get it.
Oh, and they change their mind.
Absolutely.
Yeah. So I know that our viewers will be interested in the breast reconstruction options that are available in our area. So those that you're speaking of are available now here.
Absolutely. They're very available here in terms of things such as what we call an implant-based reconstruction, or the reconstructions in what we use our own breast tissue, the patient's own tissue in terms of other parts of her body to recreate her breast. We also are available to offer things for women that have had a lumpectomy and just have a contour deformity, a special technique called oncoplastic surgery, which is really exciting to give them really good outcomes in the future.
Well, I've heard from several women that the type of experience that they receive in your practice is sort of different from other practices. Talk to me about that.
Yeah, I really take pride in that because I made a point in starting out the practice and coming back here to make it a patient-focused experience. You know, I really want to reflect that the patient has the proper education, the proper grasp of the treatment, and then we're able to really map out an individualized plan. And that highlights my perfectionist nature, and it always allows us to really work hand in hand with the patient. They have multiple appointments before they make their decision. We spend an inordinate amount of time with them, more than they're used to with other people, and we're really able to maximize the experience we have with such talented providers like Dr. Scallion and the general surgeons in the area that allow me to give the best reconstruction possible. The best reconstruction starts with the best general surgeon that's doing the breast surgery. And we've got that from every general surgical provider that we have here.
So then you do sometimes work alongside Dr. Scallion. He said oftentimes you're in the operating room together, and that's a great approach to do it. And then there's only one surgery, is that correct?
Typically, that's the goal. That's the goal. Some women have to have delayed surgeries based on some treatments that they may need or based on their medical conditions. But working together and making that our goal each time, I'm there working with the general surgeons during the mastectomy. So it allows us to create that boutique experience that the women that you're talking about really get from our practice. And it highlights the full scope of care that they get from Novant on all providers that were here.
If a woman needs to have oncology afterward, whether it be medical or radiation oncology, would the surgery be done after that or prior to that?
That's a very good question, and there are various aspects that judge that based on the pathology. Typically, that does not delay a reconstruction in terms of medical oncology, the doctors that give chemotherapy.
Right.
However, something such as radiation therapy typically is given afterwards, and that can delay a reconstruction up to 6 months. Sometimes we can do it in the same setting, however.
That would be awesome.
Yes, ma'am.
This has been so informative. It's a difficult subject to talk about, and it's such an important subject, and we're so lucky to have folks like yourself here. What would you like our viewers to know before we wrap up? What would you really like them to know about you and your practice before we close?
I just think that they should know that I am an absolute perfectionist.
I can vouch for that.
That wants to really show my appreciation for the privilege I get to be asked to be on the journey with them for their reconstruction. I take more pride in that than anything else, that they're allowing you on their journey, they're choosing you to be a part of their life. And that's something I appreciate, and that's why I spend sleepless hours planning cases individually, and why I came back to this area and I'm not somewhere else in the country, because I think that we need it here. And I think we have a unique advantage that we can tap into with all of our other providers to be able to do that here.
Well, it's been a pleasure to have you, and I know we could talk for hours on this, but we wanted to have a special show for Breast Cancer Awareness Month, and we wanted special surgeons to be here, and so we're happy that you were able to do that for us. How might our viewers reach your office?
They can call our office number at 910-754-8808. We have a Facebook page at Novant Health Coastal Plastic Surgery, and they can also look us up on the web, and you can see the link on some of the Novant websites to be able to find where we are.
Great. Well, thank you so much for providing this information to us today, and as always, it was a pleasure to have you.
Thank you. It was an honor to be here as always.